Men over 50, this is serious. Prostate cancer can develop silently, and most signs are easily overlooked until it's too late. In this video, I'll reveal 8 early warning signs that could save your life if caught in time. Stick around. The last sign is the one most doctors say men miss. Let's take a moment to truly grasp what prostate cancer entails and why maintaining vigilance over your health is so profoundly important. The prostate gland itself is a small, roughly walnut-shaped organ nestled within a man's body, yet it plays a significant pivotal role in male reproductive health. Its primary function is to produce the fluid that lovingly nourishes and protects sperm, making it an indispensable component of the entire reproductive process. When we speak of prostate cancer, the most common variety, known as adenocarcinoma, begins right within these gland cells of the prostate. However, here's where things get tricky and often deceptive. Not all prostate cancers behave in the same way. Some are exceptionally slow-growing, developing at such a leisurely pace that they might remain entirely symptomless for many years. These are the ones that frequently slip under the radar, leading to a dangerous, false sense of security where men believe everything is perfectly fine. Yet, on the other end of the spectrum, there are aggressive forms that spread alarmingly rapidly, posing grave and immediate risks to your health. These more aggressive cancers can quickly invade other parts of the body, potentially leading to life-threatening complications if not addressed swiftly. This is precisely why recognizing the warning signs and acting early are not merely advisable, but absolutely crucial for your long-term health and survival. Now let's delve into some of the most common early warning signs of prostate cancer. These symptoms might appear subtle or easy to dismiss, perhaps even mistaken for normal aging processes, but understanding them and paying attention to their persistence could genuinely make all the difference in your life. Consider number 1, frequent urination and nocturia. Have you found yourself making increasingly frequent trips to the bathroom, especially throughout the night? Perhaps it's interrupting your sleep, leaving you feeling utterly drained and fatigued during your waking hours. This phenomenon of frequent urination, particularly nocturia, waking up multiple times from a sound sleep specifically to urinate, can serve as one of the very earliest red flags your body tries to wave. The reason behind this change lies in the prostate gland's anatomical position. It sits directly below your bladder and completely surrounds the urethra, which is the narrow tube responsible for carrying urine out of your body. If the prostate begins to enlarge or experiences abnormal growth due to cancer, it can directly press upon and constrict the urethra, making it considerably harder for urine to pass freely. This obstruction then leads to increased frequency and an urgent need to urinate even when your bladder isn't entirely full. It's true that conditions like general aging, an overactive bladder, or benign prostatic hyperplasia, BPH, can also cause similar symptoms. However, here's the vital distinction. If you observe persistent or progressively worsening changes in your urinary habits, you must never simply dismiss them as just getting older. This is your body's critical method of signaling that something deeper and potentially more serious might not be quite right. Following that, let's explore number 2, painful ejaculation. This particular warning sign often goes tragically overlooked, perhaps because it's an uncomfortable or even embarrassing topic for many men to discuss openly. However, it is an issue that absolutely should not be ignored. If you begin to experience discomfort or noticeable pain specifically during ejaculation, this sensation could manifest in various areas, perhaps in your penis, testes, rectum, or even extend to your lower abdomen. While a very occasional, mild twinge might not always be cause for immediate alarm, persistent or progressively worsening pain during ejaculation could be a critical signal of an underlying issue within your prostate. The prostate gland plays a central role in producing seminal fluid, which meticulously mixes with sperm during the ejaculation process. When the prostate becomes inflamed or undergoes pathological changes, such as those caused by cancerous growth, it can disrupt this entire delicate process, leading directly to pain or discomfort. It's important to remember that painful ejaculation can also arise from other conditions, such as prostatitis, an inflammation of the prostate, or benign prostatic hyperplasia, BPH. Nonetheless, when this symptom appears in conjunction with other warning signs, like the urinary problems we just discussed or increased nighttime urination, it becomes significantly more concerning and could indeed point towards something far more serious, including prostate cancer. This symptom, beyond the physical discomfort, can significantly affect your quality of life, potentially leading to anxiety about your overall health and intimate relationships. If you find yourself regularly experiencing this, consulting your doctor without hesitation is crucial. Open, honest conversations about these issues are fundamental and can pave the way for early detection and timely treatment, actions that could genuinely save your life. Remember, when it comes to your health, no symptom is too minor or too embarrassing to bring to your doctor's attention. Next, consider the alarming presence of number 3, blood in urine or semen. Spotting blood in either your urine or your semen can be incredibly frightening, and for very valid reasons, it's a stark signal that something is seriously amiss within your body. This condition, medically known as hematuria, blood in urine, or hematospermia, blood in semen, might present as easily visible streaks of blood, or sometimes it might only be detected under a microscope during laboratory testing. Regardless of how it appears, it is critically important to take it with utmost seriousness. What specifically causes this unsettling symptom in the context of prostate cancer? The presence of blood often results from direct vascular damage or the growth of a tumor within or in close proximity to the prostate gland. As a cancerous tumor develops and expands, it can erode or disrupt the surrounding delicate blood vessels, leading to bleeding that then mixes with either urine as it passes through the urethra or with seminal fluid during ejaculation. However, it is essential to understand that cancer is not the sole possible cause. Blood in your urine or semen can also stem from various other conditions, including infections, inflammation of the prostate, prostatitis, or even a direct injury to the urinary tract. That being said, these conditions, whether cancerous or otherwise, should never be self-diagnosed or ignored in hopes that they will simply resolve on their own. Why is this particular symptom considered so urgent? While every instance of blood in these fluids is not necessarily indicative of cancer, it is absolutely impossible to know the true underlying cause without proper medical testing and evaluation. Delaying a consultation with your doctor could mean delaying vital treatment for a potentially very serious condition. The sooner you seek professional medical advice, the greater your chances of accurately identifying and effectively addressing the underlying cause, protecting your future health. Moving on, let's discuss number 4, pain while sitting. Experiencing persistent pain or discomfort specifically while sitting down might initially seem like nothing more than a minor annoyance, easily dismissed as stiffness or an awkward posture. However, this seemingly insignificant discomfort could actually be an important early warning sign of prostate cancer. This specific type of discomfort can range in intensity from mild nagging aches to sharper, more intense pains, often concentrated directly in the pelvic region. Why does this peculiar pain occur? As we've noted, the prostate is strategically located just below the bladder and directly in front of the rectum. Therefore, when this gland becomes enlarged or significantly affected by a tumor, it can create considerable pressure points in this sensitive area. Furthermore, in more advanced stages of prostate cancer, the disease may begin to spread to surrounding tissues and nerves, which can drastically intensify the pain and render simple, everyday activities like sitting down feel utterly unbearable. This particular type of pain may also radiate beyond the pelvic area, extending into the lower back, hips, or even down your thighs, further complicating attempts to pinpoint its exact origin without medical assistance. While other conditions such as prostatitis or benign prostatic hyperplasia, BPH, can also cause pelvic pain, persistent or progressively worsening discomfort that doesn't resolve on its own should never be ignored. Pain while sitting is far more than just a physical symptom. It can profoundly disrupt your daily life, making it difficult to focus, relax, or even comfortably enjoy simple activities you once loved. If you are experiencing this regularly, especially if it's accompanied by other symptoms like changes in urination or painful ejaculation, it is absolutely time to seek professional medical advice. Your prostate health is too fundamentally important to neglect or overlook. Early detection, driven by listening to your body, can make a truly significant difference in your outcome, so do not hesitate to consult your doctor and get to the very root of the issue. Let's now consider number 5, pain in back, hips, or chest. Persistent and unexplained pain in any of these areas can be a significant red flag, signaling that something far more serious might be occurring within your body. While generalized aches and pains in the back, hips, or chest are frequently and often correctly attributed to normal aging processes, minor injuries, or simple overexertion, they can also serve as an indicator of a much more concerning issue: prostate cancer that has regrettably metastasized or spread to the bones. When prostate cancer progresses to an advanced stage, it frequently spreads beyond its original location in the prostate gland, often specifically targeting bone tissue. This invasion can lead to persistent, deep-seated pain that can be felt in the lower back, across the hips, or even directly in the chest area. Crucially, unlike typical muscle or joint pain that often improves with rest or basic remedies, this particular discomfort associated with metastatic cancer usually does not improve with rest and may, in fact, relentlessly worsen over time. The unmistakable presence of bone pain is a highly significant marker of advanced stage cancer and therefore requires immediate professional medical attention. It's also a clear and undeniable indicator that the cancer has moved beyond the prostate, potentially affecting numerous other vital parts of your body. Ignoring this profound type of pain could lead to dangerous delays in receiving a diagnosis and consequently delaying crucial treatment. If you are experiencing persistent pain in these regions that doesn't respond to usual remedies or seems to progressively worsen, do not under any circumstances dismiss it as just a routine sign of aging or physical strain. Prostate cancer that has spread to the bones presents a greater challenge to treat, but catching it early can still make an enormous difference in effectively managing the disease and substantially improving your overall quality of life. Always pay close attention to your body and proactively seek a comprehensive medical evaluation if you begin to notice these worrying symptoms. When it comes to your health, it is always better to be safe than to be sorry. Following this, let's examine number 6, swelling in legs or feet. The appearance of swelling in your legs or feet might not, at first glance, seem to be directly related to your prostate. However, this seemingly unrelated symptom can indeed be a subtle but serious sign that something significant is unfolding within your body. This particular kind of swelling, medically referred to as edema, occurs when excess fluid accumulates in the lower limbs. If this swelling is persistent, doesn't resolve on its own, and is accompanied by noticeable inflammation, it could potentially be linked to advanced prostate cancer. So what exactly causes this connection? When prostate cancer spreads aggressively, it can invade and obstruct nearby lymph nodes. These lymph nodes are absolutely crucial components of your body's sophisticated lymphatic system, which is responsible for effectively draining excess fluid from tissues throughout your body. When these vital nodes become blocked or damaged by invading cancer cells, the fluid has nowhere to go. It can't drain properly. This stagnation then leads to the noticeable, often painful swelling in the legs and feet. While it's important to acknowledge that there are other potential causes for leg and foot swelling, such as heart disease, kidney problems, or prolonged periods of inactivity, lymphatic obstruction directly caused by cancer is a profound and serious concern that demands immediate medical attention. Unlike the temporary swelling you might experience from sitting too long or minor injuries, this type of swelling associated with cancer often does not resolve on its own and may progressively worsen over time. It's also worth noting that this specific swelling can often be accompanied by other discomforts, such as a feeling of tightness, pain, or even visible changes in the texture or appearance of the skin around the affected area. If you notice this particular symptom alongside any of the other warning signs of prostate cancer we've discussed, it is critically important to consult a doctor without delay. Remember, your body has remarkably clear ways of communicating when something is wrong. Swelling might appear minor in isolation, but in the broader context of other potential symptoms, it could provide the crucial clue that helps catch prostate cancer early enough for truly effective treatment, protecting your longevity. Another crucial sign to watch for is number 7, unintentional weight loss. Experiencing sudden, unexplained weight loss can be deeply alarming, particularly if you haven't made any significant changes to your diet, exercise routine, or overall activity levels. While some individuals might initially dismiss it as a welcome and effortless surprise, it's absolutely critical to understand that unexpected and unexplained weight loss can be a definitive sign of something far more serious at play, such as the progression of prostate cancer. What drives this phenomenon? When cancer cells begin to aggressively spread throughout the body, they disrupt your body's normal metabolic processes in profound ways. These rapidly growing abnormal cells demand an immense amount of energy, essentially stealing vital nutrients and resources from your healthy tissues to fuel their own unchecked growth. This significant metabolic imbalance, coupled with the body's systemic response to cancer, can lead to rapid and otherwise inexplicable weight loss, which is frequently accompanied by a pervasive, unrelenting feeling of fatigue and general weakness. Unlike intentional weight loss achieved through conscious diet and exercise, this particular kind of weight loss occurs without any conscious effort and can leave you feeling perpetually drained and exhausted, even if you are maintaining a normal or even increased food intake. It is a powerful signal from your body indicating that something is profoundly amiss beneath the surface. This symptom is particularly concerning and demands immediate attention when it appears in conjunction with other potential warning signs of prostate cancer, such as chronic pelvic pain, noticeable changes in urination patterns, or the alarming presence of blood in your urine or semen. Sudden, unintentional weight loss is a serious red flag that warrants immediate and comprehensive medical evaluation. It can be easy to overlook or try to rationalize these changes, especially when life gets busy. But your health is too precious and important to ignore such critical indicators. If you are experiencing unexplained weight loss alongside any of the other discussed symptoms, please consult your doctor promptly. It could be the most important decision you make for your health. Finally, we arrive at number 8, numbness and weakness in limbs. Experiencing new onset numbness or weakness in your arms or legs is a profoundly serious symptom that must never, under any circumstances, be ignored. While these disconcerting sensations can certainly have various underlying causes, when linked to other prostate cancer symptoms, they could be a critical indicator of advanced prostate cancer that has regrettably spread to the spine, leading to dangerous compression of the spinal cord. When prostate cancer metastasizes, meaning it spreads from its original site, it frequently targets the bones, including the vertebrae that make up your spinal column. This bone involvement can lead to what is known as spinal cord compression, a grave condition where the expanding tumor presses directly on the spinal cord itself. This compression critically disrupts the intricate network of nerves responsible for controlling movement and sensation in your arms and legs. Consequently, you may start to notice persistent tingling sensations, a pronounced loss of strength, or even complete numbness in the affected limbs. This serious condition often doesn't stop at merely affecting the limbs. If spinal cord compression is left untreated, it can progressively lead to severe problems with motor function, making simple, everyday tasks like walking, standing, or lifting objects incredibly difficult, if not impossible. Furthermore, in more advanced or severe cases, it may tragically cause a loss of bladder or bowel control, an unmistakable sign that the situation has become critically severe and demands immediate emergency medical intervention. These neurological symptoms are an unequivocally clear and urgent indication that the cancer has progressed to an advanced stage, and swift, decisive action is absolutely crucial. Ignoring these severe signs could lead to irreversible nerve damage or permanent paralysis, making early diagnosis and treatment not just vital, but often life-altering in preventing severe disability. Understanding the specific risk factors for prostate cancer is an empowering step, allowing you to remain vigilant and proactively engage in managing your health. Foremost among these factors, prostate cancer is strongly and inextricably linked to age. Your individual risk significantly increases once you pass the age of 50, with the vast majority of cases being diagnosed in men over the age of 65. This demographic trend underscores why regular screenings become even more imperative as you gracefully grow older. Beyond age, your family history plays a critical role. If prostate cancer runs in your immediate family, meaning you have a father, brother, or other close relative who has battled the disease, or even a strong family history of breast cancer, your personal risk can effectively double. Certain genetic predispositions, such as mutations in the BRCA genes, may also play a contributing factor. Additionally, compelling studies consistently demonstrate that African American men face a notably higher incidence of prostate cancer and are tragically more likely to develop aggressive forms of the disease. The complex reasons behind this disparity involve an intricate interplay of genetic factors, environmental influences, and documented healthcare disparities. Lastly, your lifestyle choices hold considerable sway over your risk. Obesity, for instance, is firmly linked to more aggressive and recurrent forms of prostate cancer. Furthermore, diets that are consistently high in red meat and processed foods, when combined with a pervasive lack of regular physical activity, can undeniably contribute to an increased risk. Conversely, intentionally incorporating a balanced diet that is rich in fruits, vegetables, and whole grains, alongside maintaining regular physical exercise, can play a powerful role in actively reducing your risk. While you may not be able to control immutable factors like your age or genetic family history, you certainly possess the ability to take meaningful steps to manage your lifestyle risks. In this context, knowledge truly is power. Staying well-informed and proactive through regular medical checkups and the adoption of healthy habits can quite literally save lives. Taking proactive steps to meaningfully reduce your risk of prostate cancer represents one of the most empowering and impactful things you can possibly do for your long-term health. While it's true that no prevention strategy is entirely foolproof or guarantees absolute immunity, wholeheartedly adopting certain beneficial habits can significantly lower your risk profile and simultaneously dramatically improve your overall well-being and vitality. What you consistently choose to eat plays an absolutely vital and fundamental role in your health journey. Therefore, make it a priority to focus on cultivating a balanced diet that is abundantly rich in fresh fruits, vibrant vegetables, nourishing whole grains, and lean proteins. Foods that are particularly high in antioxidants, such as brightly colored tomatoes, which are renowned for their high lycopene content, and cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts can be especially beneficial in your defensive strategy. At the same time, consciously limit your intake of heavily processed foods, excessive red meats, and sugary snacks, as these tend to promote inflammation and contribute to a higher overall cancer risk. Beyond diet, staying consistently physically active isn't merely good for your heart, it's also immensely beneficial for the health of your prostate. Aim for a minimum of 30 minutes of moderate exercise at least 3 times a week. Activities such as brisk walking, cycling, or engaging in strength training can effectively boost your immune system and help regulate essential hormones that are linked to cancer risk. Additionally, maintaining a healthy weight through a thoughtful combination of diet and regular exercise is critical, as obesity is a well-established risk factor for more aggressive forms of prostate cancer, and managing your weight can significantly mitigate this danger. Finally, if prostate cancer has a known presence in your family history, it is absolutely essential to have an open, frank, and comprehensive conversation with your doctor about this. Share your family's medical history without hesitation, and discuss whether specific screenings, such as the PSA, prostate-specific antigen test, are appropriate and advisable for you. Regular checkups and ongoing discussions with your trusted healthcare provider are paramount. They are your strongest allies in catching any potential issues at the earliest possible stage. Remember, prevention is about making proactive, informed choices every day. Begin today to build a healthier tomorrow. In summary, recognizing the subtle yet critical early warning signs of prostate cancer can truly be a life-saving action. Symptoms such as increasingly frequent urination, new or persistent pain, unexplained swelling in your limbs, or any unintentional sudden weight loss should never, under any circumstances, be ignored. The profound truth is this: the earlier prostate cancer is detected, the significantly better your chances are for successful treatment, a full recovery, and a return to vibrant health. Your health is, without question, your most valuable asset, the foundation upon which your future experiences are built. Therefore, do not hesitate for a single moment to seek medical advice if you notice any unusual or persistent changes within your body. A simple, honest conversation with your doctor has the immense potential to make all the difference, preserving your well-being and securing your longevity. Stay informed, remain proactive, and take exceptional care of yourself.